You know that our experts have pushed right buttons in the right places, and they've done good stuff. And with all that being said, though, she went over a bunch of different things today, and I want to share all the stuff that she went over with us, with you, and tell you just how, ahead of the curve, and that our great experts in West Virginia have been and are continuing to be, but I'll get in all that in just one second. I want to first and foremost go through just this. Another 40 West Virginians we've lost. The death toll in West Virginia is now 978. If I remember correctly, Monday I read 43, Wednesday 59, Friday 37, and now 43 or 40. It's just sad. That's all there is to it. I hope that you'll join me as I have said many, many, many prayers for all these folks, and continue to do that. Please do. Our 939th death is an 82-year-old female from Cabell County. Our 940th death, a 95-year-old male from Putnam County. Our 941st death, a 77-year-old male from Greenbrier County. Our 942nd death, a 75-year-old female from McDowell County. Our 943rd death, a 95-year-old female from Mason County. Our 944th death, a 61-year-old female from Mason County. Our 945th death, a 66-year-old female from Mineral County. Our 946th death, a 101-year-old female from Mineral County. God bless her in every way. What an incredible life. What an incredible life. Our 947th death, a 96-year-old male from Mineral County. Our 948th death, a 98-year-old female from Mineral County. Our 949th death, a 79-year-old male from Mingo County. Our 950th death, a 64-year-old male from Wood County. Our 951st death, a 67-year-old male from Mineral County. Our 952nd death, an 82-year-old male from Cabell County. Our 953rd death, a 75-year-old female from Grant County. Our 954th death, a 61-year-old female from Putnam County. Our 955th death, a 90-year-old female from Marshall County. Our 956th death, a 91-year-old male from Boone County. Our 957th death, a 77-year-old male from Putnam County. Our 958th death, a 93-year-old male from Kanawha County. Our 959th death, an 82-year-old male from Brooke County. Our 960th death, an 81-year-old female from Wood County. Our 961st death, a 76-year-old female from Ritchie County. Our 962nd death, an 86-year-old female from Lincoln County. Our 963rd death, an 85-year-old male from Cabell County. Our 964th death, an 80-year-old male from Grant County. Our 965th death, a 91-year-old male from Kanawha County. Our 966th death, an 89-year-old male from Logan County. Our 967th death, a 69-year-old male from Greenbrier County. Our 968th death, a 66-year-old male from Cabell County. Our 969th death, a 66-year-old male from Grant County. And let me step right back. I want to do those last two again. Our 968th death, a 66-year-old male from Cabell County. Our 969th death, a 66-year-old male from Grant County. Our 970th death, a 79-year-old male from Raleigh County. Our 971st death, a 90-year-old male from Jefferson County. Our 972nd death, a 67-year-old male from Preston County. Our 973rd death, a 71-year-old male from Berkeley County. Our 974th death, a 95-year-old female from Berkeley County. Our 975th death, a 76-year-old female from Berkeley County. Our 976th death, a 74-year-old female from Berkeley County. Our 977th death, an 86-year-old female from Berkeley County. And our 978th death, a 78-year-old female from Kanawha County. You know, we lost a lot of people. The youngest person that I read here was a 61-year-old female from Mason County. A couple of 66-year-olds, 67, 64. Another 61-year-old from Putnam County, a lady. You can see where this terrible killer attacks. And we'll get to that in just one second. We had 1,177 new positive cases in the last 24 hours, and our daily positivity rate is at 8.33. Our cumulative rate now has risen above 4%, is at 4.10. We have 21,000 active cases in West Virginia. I can remember when we got to 3, which was unbelievably high. We have 21,000 in West Virginia right now. 42,000 people have recovered. We have 720 people hospitalized. That's a record high. 199 that are on ICU, or in the ICU. This weekend we tested 22,405 West Virginians. That's great, but our reproductive RT rate is 23rd worst in the country. It's at 1.08. That's down just a little teeny bit. We now have 39 total counties in red and orange, 15 in red and 24 in orange. You know, all 55 out of 55 counties in the state of West Virginia, if you only look at the infection rate, are now in the red alone. You know, we'll get into just, a thing here about a reminder about if you're in excess of 65 years of age, what you need to be doing. You surely need to be really watching. From our epidemiology, data, we have now, and get this, from the deaths in West Virginia, the people that have died that are less than 50 years of age are 3%. The people that have died with COVID. The people that have died between the ages of 50 and 60 are 5.4%. And then when you go above 60, it really jumps. It really, really jumps. From 60 to 70, it's 14.25. Above 70, it is 77.5% of our people. So 77.5% of the people that have died in West Virginia are 70 years or more. Now, I think it'd probably be best to go over, I want to go over a little slide presentation that Dr. Burks, gave us today. And, I want to start off by saying, just this, she described it. I want to make this to where everybody can totally understand. She's a tremendously brilliant scholar, as a lot of our experts are really brilliant medical people. And sometimes, for me or for us out there in the world that aren't from a medical field, we just want to be told how it is. And that's what I really try to do with you all the time. There's been different surges that have happened, and you'll see that in just a few minutes. But let me just kind of just touch on just this. We have had 3 different surges, and they have happened, from a spring surge that happened, way back in April or whatever, to a summer surge, and now we're in this fall winter surge that we're in right now. The thing that you got to realize is just this, and Jordan, I think the first map, that I want you to put up is to put up, just put the depth of the fall surge and just show the new cases, the data, if you can just look at the angle of these errors. You've got a green area that's on a slope, but looks like it's probably, I don't know, maybe 45 degrees. The one in the summer may have dropped down to 42. The blue line, you see how much steeper that is? That is indicating the significance of the level of the surge that we're experiencing right now. Now go to the next one, Jordan, which is the fall evolving into winter rate of rise. Now those two that are together were the spring and the summer surges that we had in April, March, April, and then in the middle of like July, August. And now you see what we're facing here in late October, November, December. This thing, the magnitude of this is so much greater than what we had, back in the summer and back in the early spring. Now, if you'll go, Jordan, to the next thing is where our cases, our daily cases. Now, this is really important. We peaked in the spring, in the surge in the spring. We peaked in about 4 weeks. And then we started back down, which is a great sign. In the summer, we peaked in 5 weeks. From June the 24th until July the 24th, or maybe August 3rd, we peaked and we started down. The problem here is just this. From October the 12th until December the 1st, and it's still getting worse. We have now been 8 weeks. So the duration of this surge is significantly sharper, significantly greater, but the duration is hanging with us significantly longer as well. Now, I'm going to go through these really quickly, but this next chart tells us where we were 9 months ago in March, and this is a lab test positivity, and it's an RT value, and it is where we were in March. Now, if you'll just stay with me just a second and watch this. In March, we were there. In April, we were here. In May, we're here. In June, we're here. Watch how it changes. In July, we're here. Remember, that's when they had that, and don't pay attention to Virginia and Tennessee, because she said they couldn't get their reporting in accurately, and they were fumbling around with all of it, and they didn't even count it. Then all of a sudden in July, we're here. In August, we're here. I'm sorry, that was in September. We're here in September. We're here in October, and now look where we are in December, in November, December. And show where we are last week. Jordan, you got that? Yeah. It's easy to look at what's going on all across our nation. As far as new cases per 100,000 cases, go back 9 months ago. This is where you were 9 months ago. And just span right through it, Jordan, just each month. Just keep going. Watch what's happening. This is the United States of America. And last week, that's what the U.S. looked like right there. How many times have I told you there's really not any need that I can see in us going into Mineral County and closing down the bars? Especially when all of our medical team can't trace anything back to the bars. You see what's going on in America? This is coming at us in every direction that it could possibly be coming at us. And what we've got to do is protect ourselves as best we possibly can until we get to this vaccine. If we don't, look at where we are last week. The same thing is true from the standpoint of our inpatient beds at our hospitals. And just go through that real quick, Jordan. And that's what's going on with us across our nation as far as our hospitalized people. The last thing is our death toll. If you'll look at our death toll 3 months ago, and this isn't way back in March, this is 3 months ago. 3 months ago, this is where we were at. 2 months ago, this is where you're at. 1 month ago, this is where we are. And last week, you'll see that this thing is escalating across America like we can't imagine. Now, I want to go through just a few other things. I want you to really pay really close attention to this. One of the things that our experts have pointed out to me, and we've been trying to figure out how we can do this, because here's a real problem. A real problem is just this. Our kids, our people that are probably our younger sector of people that are probably 18 to 35 years of age, they're running around everywhere under the sun, and many of them are positive for COVID, and they don't even know it. They don't know it at all. Don't have any idea. From the standpoint of our kids going and getting tested and whatever, our younger people going and getting tested, well, if they don't feel bad or anything else, and they feel like, you know, even if they get it, it's not going to be much of a problem and everything, and it's probably not, you know, with the blessing of God above and everything. And so with all that, we probably don't get an incredible amount of tests done. And on top of all that, if you'll step back from it and say, well, hold on here, just everybody full stop. We tested our universities and all of our students' bodies at all of our schools all across our state. And for all practical purposes, we had incredible results from just doing that. Now here's the problem. Here is the whole problem. We were only able to do it one time. You know, now we've got kids that are going to be off and everything and are going to come back, or off now and they're going to come back. And how are we going to do it? How are we going to continue to do this? Well, there's all kinds of different ways with the vaccine that are coming out, and vaccines that are coming out that are enabling us the opportunity to be able to test more. So one of the things we're going to try to initiate, and we're working on it as we speak, is we're going to try to initiate mandatory testing of all of our students that are on campuses all across this state every single week. Every week, we're going to test all of our kids. Because if we can stop the spreading of the asymptomatic from our kids, and if our kids know they've got it, they're going to absolutely respond. There's no question that they're going to respond. We've got to be able to test the younger people, because for all practical purposes, the older people are the ones that are dying, but the younger people may very well be running around carrying this like crazy and infecting our elderly, and we don't even know it. We've got to be able to do that. You know, I made several notes when I went through, and you got to just bear with me on this. One of the things that Dr. Marsh, Dr. Amjad, you know, Secretary Crouch and everybody is already out in front of is just this, is the ability to test on age age, and age. Yeah, my dad used to always say, and I go back to this lots of times, but he said there's 3 ways to build a road. That's drainage, drainage, drainage. There's 3 ways to put a business in, a McDonald's or whatever. How's the best place for success? 3 ways: location, location, location. Well, in this situation with this disease, there's 3 ways to stop it. There's 3 ways to combat this. And that has to come down to age, age, age. So, right off the get-go, we're going to test the nursing homes, or vaccinate the nursing homes. Once we've done that and everything, a lot of the testing that they have on site and everything can be moved over to help us with the kids and testing the colleges. A lot of the tests that were sent to us by the federal government and are continuing to be sent to us can be moved over there as well. And hopefully this next stimulus package will even bring us additional dollars to move even more over there as well. Now we want to continue to test across our people and everything like we've been doing, but we need to really bear down on that sector of 18 to 35-year-old people. Now with all that, what we may very well be able to get to is a situation to where we're testing, all the county workers, or maybe we're testing all the people that work at a hospital, but we've got to really make an impact on that sector to be able to test 18 to 35 years of age. Now, because that will really help us in stopping the spread of this. Now, I just want to bring up just 2 or 3 other points that she made to us that were really, really good points that I thought, and that is just this, there are those of us that have white hair and have been around a long time, and I could tell you of vaccines that we used to take in a sugar cube, and there was even a smallpox shot that a lot of people still to this day that are my age or a little older have a scar maybe on their shoulder where they were given that smallpox shot. I would tell you, as she echoed so brilliantly, if you were one of those that was really taking a sugar cube, vaccine, or you were one of those that carries this scar around on your shoulder, then you need to go get tested. That's all there is to it. We need you to be tested. No matter how you feel, we need you to be tested. Now, and on top of all that, here's the major thing that we really need. And you got to pay really close attention to me on this, because she made it so clear to me just a few minutes ago. And here is probably the most renowned expert in the land, and I'm the conduit that's telling you. Here's the deal. We have drugs that can stop this if we catch it early enough. We do. Look at what happened to our president. And as she said today, look at what happened to Rudy Giuliani. I mean, for crying out loud, our president responded instantaneously because of antibodies and stuff that we can do if we catch it early enough. Now, the reality is just this, and I'm speaking directly from my heart and directly from her words and my words, and it's just this simple. If you dink around with this and you're feeling bad and you mess around with this and then you finally go get a test and all of a sudden we're 6 or 7 days into your positive situation, you're in real trouble. You're in real trouble. And if you're over 65 or 70 years old, a bunch of you are going to die. Now, the bottom line to this whole thing is this: if we can catch this, if you're feeling the least bit bad, and we can catch this in the first 2 or 3 days of you being positive, the antibodies are incredibly successful. Incredibly successful. They don't work hardly at all, well, they don't work nearly as effective if you're out 6 or 7 days. Now, I just want to make sure. One thing she talked about that's always on all of our minds, it's Christmas almost. Well, I mean, you know, what are you going to do with your loved ones? You want to get together? Great. From the standpoint, and this is really important, if there's kids there and those kids are too young to wear masks and you're with them, it's probably not good. It's probably dangerous. Even if you're masked up and they're there and not masked, it's probably dangerous. If you're one of our seniors and everything and your loved ones, as you're going into a house and everything and everybody's masked up and you know, give presents and all that and then you leave, it's probably okay. You're probably okay to do that. So I'm telling you, you know, from my standpoint, you know, I would say if you're going to be in your children's homes or whatever like that, and everybody can be wearing a mask and everything while you open presents, and then I would move through those things as quickly as possible and enjoy, but at the same time get through, and then understand you're on a short timeline to a vaccine. We just got to make it to the vaccine. That's all there is to it. The other thing that came out today that I want to tell you about is just this. You know, and I know I'm going to get in a little bit of trouble about doing this, but I want to encourage so much. Now, our health officials are going to say, well, if you say this, somebody then is going to say, well, I'm just going to settle in for that. But listen, upon the first dose, you know, you got to take it twice, 21 days apart. You know, the side effects are very, very minimal. You know, absolutely, you know, I think my daughter Jill was talking to one of the docs at one of the lung specialists, or the number one guy at Johns Hopkins. He told her that he had a great friend that headed up the team and everything with the Pfizer deal, or the Pfizer vaccine, and they said that in 30 years of work with all kinds of vaccines and everything, that all the work they've done, this is the safest one they've ever had. So from the standpoint of taking it, I think you're good to go. Today, we have vaccine right now in the state of West Virginia. They came into Mon County this morning and they came into Kanawha County, and we're going just as fast as we can to get people vaccinated right now. Just for your benefit to know that I'm all in, I'm going to get vaccinated, and I'm going to get, so you can see me get vaccinated right here at 5:30 today. Now, with all that being said, I would say to you just this. Upon the first vaccine, the first one, you got to take 2. If you take 2, upon the second one, you're 95% covered. Really and truly, on the first one, you have some significant coverage, nowhere close to anything like we want it to be, but you've got some. And so I would encourage every single person in this state, you know, there are people with, and I don't know what it exactly was, but you know, certain things. I think, you know, one is if you're thinking about having additional children, you know, and there's something about pregnancies and everything, you probably need to have the medical team, you know, follow through on that, and so our National Guard is on this. They're going to be distributing it all across our state, and they're going to be doing it right now. I want to read just a few things here to you. You know, on Friday evening, I want to make sure I'm not forgetting that. No, I'm good. On Friday evening, the Pfizer vaccine received emergency use authorization. You know, with that, they began to ship things out on Sunday. You know, they arrived in West Virginia this morning. And in Kanawha and Mon County, you know, I think you can see our guard there working with them right there. They will arrive tomorrow in Greenbrier, Cabell, Berkeley counties. Vaccinations will begin today for West Virginia. You know, I cannot express how incredible the achievement of all this has been. It's been unbelievable. And we're ready in West Virginia and to show the rest of the country just how good we are and how just great that we perform under real stress and all the complexities that we've had to deal with. If you're receiving doses from this first shipment, you will be contacted by your employer on where and when to schedule your appointments. By working with our partners, we will take care of those in our nursing homes and long-term facilities, and we have incredible partners from various organizations working with us across the state to make all this happen. The allocation plan, now that the Pfizer vaccine has received authorization, I want to provide an update on our plan to get these out to West Virginians. I know many of you want to know when you and your loved ones can get these vaccines. With our limited supply at first, you know, here's the four key principles that we'll be following. Reduce the rate of hospitalizations, reduce the rate of deaths, protect our most vulnerable, ensure our state can maintain critical services. You know, and there's no really point in me going through all of slides, you know, 1A, 1B and everything. The one thing you'll see about, you know, beginning in 1C and 1D is there'll be much more emphasis put on our aging from 50 years up. The one thing that is really so apparent is just this. There's people out there that are 65 years old. If we leave this entirely up to the pharmacies to say, well, that 65-year-old really has more chronic problems than that 65-year-old. Well, we're going to get a food fight like you can't imagine going on. Well, I'm sicker than she is, and whatever. And so we just need to absolutely dial into age and age and age. And that was Dr. Burke's message through and through. You know, I want all the West Virginians to know that I have all the faith that I can possibly have that this vaccine will work and that this vaccine is safe. You know, I'll be taking it, like I said, at 5:30 today. And absolutely, I want everyone to know that I think it's good to go. You know, there's been a lot of work. Our FDA is the best of the best. And absolutely, we know from looking at that map that we better do something. And this will break it. This will absolutely break its back. Just vaccine reminders, the COVID vaccine will protect us. Clinical trials with tens of thousands of people have demonstrated the vaccine is highly effective and safe. The vaccines require 2 doses. Our allocation numbers will continue to change and they'll ramp up really quickly. And again, until you and the people who live with you are vaccinated, this is our absolute best defense. And so please, until that happens though, continue to wear your mask, do everything you possibly can to not get this or not spread it. You know, today is I want to say one more thing about our face coverings. You know, you can't imagine the hours that have been put in by our experts. And you can't imagine the number of people that we consult with. You cannot possibly argue with me or any of us about the effectiveness of the mask. This right here is your tool right now until we can get you vaccinated. We're going to move at light speed to get you vaccinated. But absolutely, this is your tool right now. And if we want to shut this thing down, you've got to wear your mask. That's all there is to it. You have got to wear your mask. Now, let me just say just this. Overwhelmingly, 96% of the people are all in wearing your mask. They don't like it. I don't like it. But they're all in wearing your mask. So so if you're in the 3 or 4 or 5 or whatever percentage of people that believes by some unknown reason that you have a right not to wear your mask, well, you can not wear your mask all day long if you want to be by yourself. But you cannot possibly expect to be able to transfer this terrible disease to someone else because you have decided, well, you're not going to do it. That's just not fair. It's just not right. There's no difference in that in saying, well, I'm drunk, I'm going to drive because that's my right. Well, it's not. That's all there is to it. You need to wear your mask. Today is a birthday for our National Guard, the 384th birthday. And there's no way in the world to be more thankful. I've said it over and over. We owe everything we have to our military. Our National Guard in this state is spectacular beyond belief. We've had General Hoyer with us a long time and everything. He's done a phenomenal job. And he's going to go on, but he's still going to be with us, and he's going to do a lot of other stuff and everything. But General, why don't you step in here and just tell us how proud we are of the National Guard and how proud I am of you and all the great people that work with Guard.
Yes, sir. As the governor pointed out, the 384th birthday of the National Guard on birthday day, the Guard was at 5 hub sites preparing for the receipt of vaccines. We're exceptionally proud of the Guard and our lineage that goes back to 1735. And I'd remind people from West Virginia that the 201st Field Artillery, the West Virginia National Guard, is the oldest continuously serving unit in the United States Army, not in the National Guard, but the United States Army. And Governor, we greatly appreciate the leadership and the support that you give to the Guard, and we will continue to execute this exceptionally important mission of taking care of the people of West Virginia.
Well, Governor, I'm sorry, General, I can't, no way I can thank you enough. You know, if you could be in my shoes just for a little while and just see the greatness of what these people have done, our Guard's the best. I mean, they can't be any better. Like I said, I've seen them wade in the mud looking for bodies, and I've seen all kinds of different things that they've done. It is unbelievable, and they'll do this vaccine mission with pride, and they'll do it absolutely tremendously. I know they will in every way. And happy birthday! You know, what a wonderful day. You know, I continue to urge people to get tested. Our free testing maps are up. Our drive-through pharmacy stuff is up. You know, we now have 17 red, I think 19 orange counties on our school map. You know, in school outbreaks, we're still phenomenally good there. We've got 19 school outbreaks. We're down from a little over 100 to 68 confirmed cases in our public schools. You know, that's really, really good. 116 outbreaks at our long-term care facilities. Our churches are down to 15 outbreaks in 14 counties. That's a little better. Braxton, Cabell, Greenbrier, Harrison, Lewis, Marion, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Taylor, Webster, and Wyoming counties. You opt out to go to church and you're 60 plus years of age, I'd really think twice about that. I know how important it is, but you're so close. You're so close to having a vaccine, and this whole nasty thing will go away, and we'll be able to go back to some level of normalcy, you know, that will be so good. Don't just absolutely just go. You've got so much life in front of you. You know, if you happen to be 60, think about the lady that I just, you know, called out here today, and I think it was a lady 101 years old that we lost. You know, why throw away all the wisdom, all the experience that you could tell many others about for years and years and decades to come, you know, let's try with all in us to stop this thing and wear your mask. And really, if you're an elderly person, don't go out, you know, if you don't have to. Just don't do it. From the standpoint of corrections, we've got 358 active cases in the state, 281 at Northern, 29 at Pruneytown, 24 at St. Mary's, and 14 at Central Regional. You know, again, we got 78 staff members all across the state, you know, that are positive, but for the most part, corrections is doing a great job. The flu vaccines, you know, I tell everybody every day to get your flu shots. They're for everyone older than 6 months of age. Now, you know, we are quickly approaching our deadline on the cities and counties CARES money. We bumped it up from 200 to, I don't know if it was 210, and then we went to 225. You know, we're at 225,625,000 right now. We'll probably have to bump it up a little bit more to get us across the finish line there. We're hopeful that another stimulus package is on the way. I have no idea what in the world that Congress is doing. You know, D.C., Washington is, I mean, it's a three-ring circus, and there's a lot of people hurting, and the circus is all about politics, and it drives me nuts. I encourage everybody about giving blood. It is really important if you've had COVID and recovered to go give blood. It'd be just wonderful. There's a call at 4 o'clock today with the Vice President, and I'll be on the call. You know, it's a video conference with all the governors and everything. I'm sure the center of most of what will be talked about is the vaccines, and we'll be doing all that. And at 2 o'clock today, so we're going to probably have to hurry a little bit with our questions and everything, but at 2 o'clock today, I will join the Secretary of State, Mike Warner, and to host the official meeting of West Virginia's presidential electors to vote for the President and the Vice President of the United States in the manner prescribed by the Constitution and the laws of the U.S. West Virginia has 5 electoral votes in the United States Electoral College. I encourage all West Virginians to watch the ceremony to see how the process works, especially kids. You know, kids, you know, can see something happen here and everything, history, you know, that they probably have never seen before, and it's you know, not only educational, but it's just part of this great nation that we have. So with all that, I've talked a lot. I thank you so much, and I'll defer to others now.
All right, thank you, Governor. First today, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, we have received vaccines in the state at 2 hub locations. Those hubs are in fact processing vaccines for distribution to other sites within their regions of the hub. At this time, things continue to move along smoothly. Once we have identified where the first shots have been provided to individuals, we will provide that information to Governor Justice so that he can inform the public as the process moves forward. We continue to, in addition to that, work various support to local health departments, as well as prepare and conduct sanitization missions today. Appreciate the work of all the agencies in the Joint Interagency Task Force and the outside organizations such as the Hospital Association and the West Virginia Healthcare Association that represents the long-term care and some assisted living facilities. This is not just a whole of government, but it's a whole of West Virginia approach. And the governor and I greatly appreciate the work that goes on, particularly from our counterparts at DHHR. This is a team effort, and we're making great progress. Thank you.
All right, thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's great to be with everybody on this really very extraordinary day, the first day that we have received the COVID-19 vaccine in West Virginia. I also want to thank the governor for his leadership, and certainly Major General Hoyer, Joe Peel, our colleagues at DHHR, and through a number of other different sectors. This has been a great team. let me address three issues today in my comments. So the first issue is I want to reflect on our visit from Dr. Deborah Birx, who has been a leader from an infectious disease and epidemiology perspective for the entire COVID pandemic. As the governor pointed out, she related to us the great increase in the number of cases of COVID-19, of the increase in hospitalizations, and particularly in the eastern and the western sectors of the country. She said that the center part of the country is doing some better, mostly she believes because their hospitals filled up and they really became very worried about where they were going to be hospitalized. As the governor said, one of our chief focus areas, and has been the entire pandemic, but also is during the vaccine, is to maintain healthcare and hospital capacity. So not only can we take care of the sick people with COVID, but we can also take care of people who have heart attacks or strokes or bad infections. So maintaining that capacity is really critical. And at the same time, we also want to save lives. And by saving lives and increasing and supporting that capacity, we will then, for West Virginia, make a big difference. Ultimately, as the governor said, and Dr. Birx said this too, that the age of people who get infected with COVID-19 is the single best predictor of death. So going back from the CDC's information that was published in August, we know that in comparison to 18 to 29-year-old people infected with COVID-19, those people over 50 years old, 50 to 64 years old, have a 30 times higher risk of dying. People who are 65 to 74 years old have a 90 times higher risk of dying. People 75 to 84 years old have a 220 times risk of dying from COVID-19, and people over 85 have a 630 times increased risk of dying. And from our West Virginia own data, as the governor said, people under 50 years old in West Virginia infected with COVID-19 impact only 3% of all of our deaths. People from 50 to 60 years old account for 5.4% of our deaths. People from 70 to 80 years old account for 14.25% of our deaths. And people over 70 or over 80 years old account for 77.5% of our deaths. I'm sorry, over 70 years old, 77.5% of our deaths. So as we look at those populations, then targeting those populations is really important. And part of what Dr. Birx was really pleased about the priority plan that we have come up with and the governor has approved in West Virginia is the fact that our phase 1A and 1B is really going to target those hospital workers and acute care jobs in the hospital, in ICUs and intensive care units, and emergency departments and COVID units, who we really need to keep functioning. The other group that we're going to start to focus on are nursing home patients and people that work there, just as the advisory committee for immunization practices from the CDC. That's exactly what they recommended for the entire country. In our 1B area, we are going to then target immunizations in people in the first responder areas, those critical services that we can't do without. And the two groups with the acute hospital workers, the nursing homes, and the first responder groups, all ages will be immunized in those groups. And then when we get down to other hospital workers, other healthcare workers, and then vital industry sectors like utilities and food and others, we're really going to focus on that over 50-year-old group, because as we talked about, if we can immunize people over 50 years old in West Virginia, then we will basically account for 98% or 97% of all of our deaths. So targeting that group will save lives, but also it will reduce that pressure on hospital beds, because these are also the people that get sicker and need to go to the hospital. So as we're moving forward, Dr. Birx was very pleased with our focus, with the governor's decision to really start to get these vital industry sectors, healthcare sectors, first responders, but also start to really think about that age impact, because that's what people are dying of COVID in West Virginia, are people that are and have higher ages. And we've seen that also as national data. That's the first thing I want to talk about. Second thing I want to talk about real briefly is this vaccine. So for people out there who are worried, this may be the safest vaccine we've put out so far. The way it's constructed, the fact it's just the genetic information that's synthetically generated of just a little part of the virus means that you cannot get an infection from the vaccine. It does not include any of the other parts of the virus, so there's no opportunity to be infected. It is incredibly effective. 95% of people who got the vaccine were protected against getting COVID. Nobody who got the vaccine died from COVID, which is really important as well. And this same advisory group came out and said that there are no absolute contraindications to getting this vaccine. If you're pregnant, the group recommends you still consider getting the vaccine. You should consult with your doctor. If you've had an allergic response and carry an EpiPen, that is not an absolute reason not to get the vaccine, but you should talk to your doctor, and you should make sure that you're observed for about 15 minutes after you get the immunization. If you're getting treatment for cancer or whatever, you can still get the vaccine. If you've had COVID, even though, of course, we don't want people to come out who are acutely infected with COVID and still need to quarantine or isolate in their house, but there is no time frame from when you got COVID that is a contraindication to you getting the vaccine. Usually antibodies, the immune response lasts for about 3 months or so after a COVID infection, but you are eligible to get the vaccine even if you've had COVID. And the last thing that we've talked about is that there is no way that women can be sterile from getting the vaccine. That was a misinformation internet rumor. So the governor is going to take the vaccine as evidence in his confidence. We will all take the vaccine when it is our time to do so, and to demonstrate our confidence in this. This is a very safe vaccine. It is a very effective vaccine, and it's something West Virginians need to do. All of us need to do. Lastly, there's new evidence from the Centers for Disease Control in America that says that the spread inside a household from COVID-19 with close contacts without masks is about 35%, higher than has been reported previously. It really does, and Dr. Birx said this too, it really does emphasize how important it is when we're around each other during this next holiday that we all wear masks and we stay distance as much as we can, because spread does happen even in houses where people know each other. So thank you so much.
All right, thank you, Dr. Marsh. Next to Secretary Bill Crouch with the West Virginia DHHR. Secretary, you're still muted.
All right, good afternoon, everyone. It is a wonderful day in West Virginia. As the governor said, we had vaccine delivered this morning. That vaccine, as General Hoyer said, is currently being distributed to other sites. As we move forward in this new phase of the pandemic, we want to make sure everyone has accurate information. So we want scientifically sound, accurate information, and we're posting questions and answers information on the DHHR website. That website will be updated this afternoon. The information on that website is based upon guidance from the FDA and the ACIP. The ACIP is the Advisory Committee on Immunization Practices. We thank them for that information. It will be available later today on the website. Our medical advisory group has been reviewing the new data and has recommendations, has made recommendations based upon that information, and we are very appreciative of their expertise in this process. I'll close by saying that the vaccine is here. We need to all get vaccinated when it's our turn, and that will be in the next several months for everyone. There are priorities aimed at saving lives by protecting our important healthcare workers and our elderly population in the state of West Virginia. Everyone will have the opportunity to get vaccinated. Until then, please do as the governor is asking, wear your mask. That is an immediate vaccine for everyone and can save lives itself. So thank you very much.
All right, thank you, Secretary. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. We have several counties across the state that report 4 things in common that have shown a decrease in cases. So I just want to highlight those 4 things that they've been telling us. One is that they have robust testing across the county. The community members do know the testing locations, the times, and the access. So this has increased or decreased the cases. They also show that businesses have been united as far as masks being worn in those businesses. Also strong supportive community members in that county, whether it's through their leadership or through local groups. Also, they're seeing a shift from attendance in church communities going virtual. So those 4 things in these counties have shown a decrease in cases. So we did want to bring that up, that we are seeing some of those things going in our state. So we want to encourage people to continue that. A lot of community involvement with wearing masks and showing that kind of unity does help. So thank you very much.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers here. I'll be quick because I know there are other reporters who want to get a question in. But my question would be in regards to testing. Are we seeing a slowdown in testing, as in the number of people getting tested? I was looking at some data comparing 14 days over a previous 14-day period, and it looks like we're seeing a small drop in testing, about 3%. I didn't know if that was something state officials are seeing as well, and if there's any concerns about that, especially since we've dropped Vault already after a week, and in regards to other type of testing opportunities. Thank you.
Stephen, let me, I'm going to pass this to Dr. Amjad, but Stephen, you got to remember, we've tested 1,321,330 tests in this state. We only got 1,700,000 and change people. We've tested almost as many tests as we have total people. And so at some point in time, I would expect it to slow down no matter how much our intensity is, but Dr. Amjad, you could go, please.
Sure, Governor. Steve, there has been a little bit, mainly due to the cold weather. I mean, we do have some community testing lanes. Also, as our National Guard is shifting towards the vaccine distribution plan, our health departments do have to participate in that more. We do still have the pharmacy testing that's still available through Walgreens that you have to make an appointment, but with the cold weather that has occurred, we do see a little bit of drop, but we still want to encourage people to, contact their local health departments, visit their Walgreens. Also, they can speak to their physicians about getting tested, but that is expected as the cold weather does come in, but we still want to make sure people do go out there and get tested and talk to their physicians, especially if they're having symptoms. Thank you.
All right, thank you, Stephen. Next to Kenny Bass of WCHS and Fox 11.
I have a couple of quick things I need clarified in the question. The governor said, I thought he was going to get vaccinated at 5, but then he also said 5:30. So what time is that happening? Also, testing every college student in West Virginia. Is that both public and private colleges? What's the difference going on there? And then finally, as far as vaccine distribution, only speaking from a news agency standpoint, it feels like there's some double top secret stuff going on here where we haven't been notified where the vaccines have been taken to, other than generally Kanawha and Monongalia. I'm guessing the health departments received those, but there's been no opportunity for us to take any video, any pictures to document what's going on, or at least to be around to share that information with people that are obviously very, very interested in what's going on with vaccine distribution. So can you let us know where we can go to start telling the stories that people want to know about this vaccine distribution? Thank you.
Okay, Kenny. First of all, I think it's at 5:30 now, and the reason we bumped it back a little bit later and everything was just the simple fact that the vice president's calls at 4 o'clock, and we don't really know how long that's going to run. But with the update from Dr. Birch and everything, you know, on a lot of stuff, we sure want to get the entirety of that call. So that's at 5:30. One thing I want to add as far as the testing, going back to the question prior that Stephen had, you know, here is a really important component of this. You know, there's a lot of people out there, and I've encouraged this too, you know, to go get tested. If you have an anxiety about what's going on and everything, get tested and everything. Well, in all of that, you know, we have people that are repeatedly being tested and everything, and because they're concerned, they're scared and everything. We want them to do that, but we want to be sure that we are truly targeting and testing the right people. We got to get our elderly tested and everything, because if they have it, we can help them, and we can help them if we move really, really quickly. If we don't, there's a high percentage of them that are going to die. And so we really need that sector being tested, and we need the 18 to 35-year-olds being tested from the standpoint of them being asymptomatic and spreading it. So from the standpoint, if you get feeling the least bit bad and you're not feeling exactly right, you're thinking, well, it's probably a cold or something like that, go get tested right then. You know, you need, you know, you see me, you hear me talking all the time, run to the fire. Think about it just for a second. Think about just this. And these were the words of Dr. Birx just a few seconds ago. But what she said just, and not seconds, but minutes ago, what she said was this: you, if you're 65 years of age and older, or maybe even 60 and older, 50 would be fine with me, but if you're any of those ages or older and you have any symptoms, you need to treat this just like you have symptoms of a heart attack or symptoms of a stroke. You need to run to the fire and get tested. That's all there is to it. You do not need to put this off and say, well, let's see how I feel tomorrow. You wouldn't do it if you were having a heart attack. You wouldn't do it if you were having a stroke, and you can't do it if you're having this. So remember that. And Kenny, as far as where the sites are and all that's going on, I don't know myself. And so, General Hoyer, maybe you can give us a little more, you know, transparency on that.
Yes, sir, Governor. So, Kenny, there's nothing secretive. So we're not trying to be super secret. We announced just generally as a protocol the 5 locations by general location. We have a joint information center set up as a part of the Joint Interagency Task Force. Holly Nelson from our West Virginia National Guard staff can be your point of conduit on that, and we'll provide you as much information as we can. We're also going to provide B-roll. Part of the initiative is to make sure that we don't get folks jammed up at sites to try to do coverage. We appreciate the work that all of you guys from the media have done in working with us throughout this pandemic, and we will try to be as helpful to you as possible, but please reach out to Holly, anybody that has any particular request for tracking or looking at anything, and we will work with you. Thank you.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with W News. I want to follow up on part of Kenny's question. So, Governor, could you clarify what you meant about student testing? I thought you also mentioned, you know, K through 12 students in there. Who are we talking about testing, and when would that start? Thank you.
If I said this, you know, K through 12, I don't think I did, Charles. But if I did, I didn't mean that at all. I mean college students. I mean students that are, you know, 18 to 35 years of age, and I know we don't have many students that are 35, but that demographic, that is the target of the asymptomatic people that are spreading this all over the place, and don't have any idea they're doing it. And so a surefire way that we can get at this is test all of our colleges, test all of our students at all of our colleges every week. It has to be every week. In order to be able to have a tight grip on this, we got to do it every week. And Dr. Burks had a tremendous idea on how to do that and is a tremendous advocate of that and everything, and that'll really help us. So that's what we're going to do.
All right, thank you, Charles. Next to Mark Curtis with Next Star Media.
Let me just follow up on that a little bit. You said K through 12. Does that include pre-K teachers as well? I've gotten a couple of calls from pre-K teachers that are wondering about them.
Gosh, guys, will y'all please listen. I am not saying anything about K through 12. Not anything. This is just for our colleges, just for 18 to 35. You know, I am not saying K through 12. You know, and if I am, I'm losing my mind. But I have repeatedly said this is colleges, you know, college 18 to 35-year-olds. That's what we're trying to test, and you know, and any teachers that we would have that are above the age of 50 will be targeted first.
All right, thanks, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Getting back to the don't wait to get treatment that you were talking about, Governor, what is the tipping point there? You could go out, get tested, test positive, you're self-isolating or quarantining, whatever word you want to use, but at some point you're getting a little bit sicker. How sick should you be before you go in and decide that, hey, I'm not mildly symptomatic, I'm very symptomatic now, before you get treated for the illness?
Is this Paul? Okay. Paul, I mean, this part of this came from, this came from the head person, Dr. Burks. And she basically said just this, that if you are above a certain age, now we would say 50, but she was saying 65. If you're above the age of 65 and you have symptoms, you need to go get tested right then. You should treat it like a heart attack or a stroke and go get tested right then. From that point forward, the medical community will treat you. You know, if you in fact are tested positive and you're 65 years of age and you are just days into this, a couple of days into this and everything, then all the things that the early drugs have that work to their advantage, like miracle drugs, the antibodies, the drugs that the president took to be able to really help him instantly, and Rudy Giuliani and so many others to help them instantly, they're available. But if you drag along with it and you just stay home and you haven't really been tested and everything else, the medical community really can't help you because they don't have any idea that you're positive because you're at home, you know, or wherever. And you don't really, you think you got a cold or you don't know what is going on and everything. And then by the time you go in and you say, well, a week ago last Sunday, I started feeling bad, then the antibodies and the early treatment drugs won't help you much at all. So the bottom line is you got to treat it if you're, especially above the age of 65, if you get feeling bad, you've got to treat this like a heart attack and you've got to go get tested right then. And then the medical community will take over and they, I'm sure, will say, well, you're only 2 days into this and this level of treatment and this level of medicine will really help you, and it's proven that it will. If you're out of that window, if you're 6 or 7 days into this, you haven't been tested, and then all of a sudden you find out, dag, you know, I've been sick for a week plus, and now I've got a positive test. Well, I mean, if that be the case and everything, probably the antibodies aren't going to be very effective.
All right, thank you, Paul. Next to Kimberly Keggy with WSAZ.
Good afternoon, everyone. I did want to ask you, other states have laid out, based on their state plans, how soon they anticipate the long-term care community to be vaccinated. So in West Virginia, how soon can we anticipate the entire long-term care community to be vaccinated?
Well, again, guys, y'all got to really pay close attention because we said over and over and over, they're the first priority, the first. And so we're going to be vaccinating them immediately, right after our healthcare workers. They're the first right after our healthcare workers. So it will be, Dr. Marsh or General Hoyer, somebody weigh in, if they need more clarity, but I don't know how I can make it any faster than that.
Really, the current objective, as the governor laid out, the two priorities and the current objective on long-term care facilities' first dose would be no less than 30 days, but we believe that we can accomplish it in potentially 3 weeks with appropriate coordination with the long-term care facilities. That would be the residents and most of the staff who are able to do it.
All right, thank you, Kimberly. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi there. My question is about testing in the higher ed again. You just mentioned Dr. Birx's idea, and I wanted specifics, like who's going to offer those tests and like who's the burden going to fall on? Is it going to be the school's responsibility, or is the National Guard going to go in there? Do we have any idea about cost at this point and how we're going to pay for that?
Well, and Dr. Amjad hadn't had the opportunity to speak, but I'll let her speak just a second. But there's 2 or 3 different ways to go. One of the testing, I think, agencies is offering this test for $25, to be able to do it on that basis. There is another test that is basically, a test that is coming from the federal government. It's $5. And we have, and Secretary Crouch, you can maybe you're better to jump in than anybody, but we have now on board 100,000 plus of those tests. To be perfectly honest, I think you're probably going to need about 125,000 a week, and we're due in additional supplies of those tests and everything. And I think we're scheduled to have 550,000. They'll get us out for probably the next 4 weeks, or when the kids come back to school for 4 weeks thereafter that. And right behind all that, I'm really very hopeful that there's going to be, with the passage of this additional stimulus package, there'll be additional dollars and additional tests that'll be flowing right to us to be able to continue to do that. But Secretary Crouch, if you've got any more to add, please feel free to do so.
Yes, Governor, thank you very much. We have right now about 86,000 antigen tests in our warehouse. We have 200,000 tests on order right now, so we're looking at getting more antigen tests, and the federal government is pushing antigen tests to all states. So we're looking for another shipment there. So as the governor said, it will take us out for a few weeks. We're constantly ordering additional tests. We're constantly trying to find lower cost tests, quality tests that we can get. As you know, we started testing first in the country. The governor had us test nursing home staff twice a week rather than once a week, as CMS was requiring. We're screening, doing surveillance testing on correctional facility staff. We're really looking to pick up those asymptomatic cases out there. So the governor's directed us to focus on the college and university students, and that's what we'll be doing in the next few days here to develop a plan for that.
All right, thanks, Emily. Governor, I'll turn it back to you.
Okay, on the last question, I'd like to just add just this. If you'd have been in a meeting with Dr. Birx, as she was going through all kinds of different things, we were talking about the kids at our colleges and getting them tested and everything. I'm thinking about the overwhelming numbers. I mean, just the magnitude of the numbers. If you take all the kids and staff, you're probably looking at a number of in excess of 100,000 a week. And to be able to pull that off and to do it, how do you do it? Well, They do it at some schools across the country that are doing that now. They do that, you know, with their event services people and everything, you know, and this antigen test. And that test costs $5. So all of a sudden the economics of it start to make a whole lot more sense. And even if the other test level at $25, the economics of it become standable. And so with all that being said, I do think we're going to be able to do it, but we're early in the stage on that, but we should really be all over that right now, and we're moving in that direction, really quickly. The only other things that I had to say are just as simple as just this is, you know, Christmas is coming upon us. You see the length and the duration of this last surge. It's lasting longer than what we thought. You know, you see the vaccine, it is incredible to think that this is here. You know, President Trump deserves a lot of credit. A lot of really, really wonderful scientists and people that have just worked their tails off to be able to pull this off. It is an amazing feat. It is another amazing American feat. You know, so we should all be really, really proud. I encourage everybody to take that vaccine. I absolutely have given you some ideas on things and ways that you can celebrate a little bit of normalcy, you know, at Christmas, and just know just this. As we move, and we move with light speed, you know, the president's program is called warp speed, you know, and as we continue to move at light speed or warp speed, you know, at the end of the day, we're just a very, very few months away from crippling this killer. And if you're 60 or 65 years of age, please take heed. You know, wearing your mask and going over to your loved ones and opening presents and leaving is one heck of a lot better than your loved ones showing up outside a glass, looking through the glass and watching you pass away. I cannot be any more blunt. I cannot be any more straightforward. You may not like me being that blunt, but it's the only way to be. We can absolutely get through this, and we will. But you can get through this with us if you'll just pay close attention to what we're saying and try with all in you to do it. God bless each and every one of you. You have been superstars. You have, I wish so much you could all hear these great experts speak about West Virginia, I am telling you to God above, and I don't ever tell you anything but the truth. But Dr. Burke just said, how is it that all these smart people are in West Virginia? We never would have thought that ever. We never would have thought that ever. West Virginia? You know, but you see, that's what I've always told you that you are. You are the best. You are the diamond in the rough that everybody missed. I wish so much you could hear what the others on the outside are saying about us, about West Virginians, about our medical experts, about all of us. Just keep it up, West Virginia. Take heed to what I'm saying right here and get through this Christmas season.